Welcome parents to Hamilton High School's Parent Presentation Series. We started these parent presentations about 4 years ago because we saw there was a need to provide some support services to parents in our community and within our school. These parent presentations provide a wide range of topics. We have expert speakers that talk about social media, communication, mental health issues, all the areas that teens are going through, and to educate parents on what they can do, resources they can obtain, and just support services. We also have a student educational series at the same time in the evening, so you can bring your child with you and they will go to a separate classroom and they will get education on the same topic. Most teachers give extra credit, but your child will always get 2 volunteer hours for every session they attend. And at Hamilton, we also have support groups that the social workers run. We have support groups for anxiety, depression, and self-harm. We have groups for grief, substance abuse, anger management, and we also provide one-on-one support to students, as well as meet with parents if there's issues you might be struggling with and need some professional guidance. You can come and meet with us. And so at Hamilton, we provide a great deal of services. Please contact us if you need any additional support, or we can sit down and talk about ways that we can help you and your child be successful during these high school years. Thank you so much for coming to our presentations, and these presentations, as you can see, are videotaped and will be available 2 weeks after every presentation, along with the PowerPoint and any other materials. We will have them on our website. So thank you and have a great day.
So first of all, thank you for coming. My name is Dr. James Bogash. I'm a chiropractic physician, been in practice this month, 20 years. And to give you an idea of my background, for the past 20 years, I've managed to read on the range about 120 medical journals a month, always looking for things related to natural medicine, wellness care, disease prevention. Physiology, or the way the body works, is my passion. And unfortunately, there's generally a huge gap between what we know in the research and what happens in a typical doctor's office, specialists included. So tonight we're going to talk a little bit about natural alternatives to pain, as well as a brief intro from Dr. Indermeal, who was not able to make it today, who's an ER physician at Dignity Health. Go over some brief things to watch out for on the medication side, and then I'll go over a short primer on what to do to avoid them in the first place, because I'm all about prevention. So with that, we'll get started. We'll start with, like I said, a brief primer on let me see if okay. So when it comes to the use of opioids for pain management, we don't need to talk about the crisis. Everybody's aware of how much of an issue this has become. And even the most recent data from 2016-17 still finds that there's an increase in abuse in the opioid drugs. Some of that's now street-oriented from people that had become addicted on the prescription side of things. A couple things to ask for, and this is obviously geared towards children, parents who have kids who might be athletes or otherwise injured. Dental procedures, minor surgical procedures. There's a lot of times that we use opioids that we may not necessarily need to use them. And so the first question is are opioids really even needed in this particular scenario? Is something like Tylenol or ibuprofen going to be effective for controlling pain? And do we need to start with something? And a lot of patients don't even realize that, like Percocet and Vicodin, actually, and even Tramadol are in the opioid class. And we've gotten a lot more press lately, but there's a lot of parents who weren't even aware that their child was given Percocet and that's an opioid. So we need to make sure that it's even necessary. And as mentioned, Tylenol, acetaminophen, or ibuprofen, Sometimes topical things. Topical diclofenac is an anti-inflammatory, so can we use that instead if it's a strained sprain and you're in urgent care? Or lidocaine, which is an anesthetic. There are a lot of times the lidocaine patches, sometimes you can even get those over the counter, that we can use to help with a painful situation instead of taking something orally. We'll talk a little bit more about other alternatives in detail in just a little bit. However, if we do have a point where opioids are needed, and we're looking at intractable pain, something that's not responding to anything else, or it's starting to interfere with sleep because somebody's hurting so much, we need to make sure we follow some general guidelines. Always start with the minimum amount. Just because your doctor says take 3 doesn't mean that we should take 3. Start with 1. Everybody has a different response to medication, and starting with the lowest dose possible is always a better option. Give yourself about 4 hours, or your child about 4 hours, to see if it's going to work. If it's been a half hour and it's still hurting, it doesn't mean it's time to try the next one. We need to give that medication time to kick in. So about 4 hours, if that's not working, you can look to see about adding another one, and never take more than's prescribed by the doctor. And take it for the least amount of time possible. We've gotten much better of shortening prescriptions, but there were all kinds of nightmare stories of people going for an ankle sprain and they get 2 months worth of Vicodin. Those days are over, but if you were given something for, let's say, an ankle sprain, which opioids are probably not the best indication for that, but 2 days later you're feeling much better, then we don't need to continue taking them. And once we're done with them, we need to make sure that we dispose of them properly. We'll talk about that in a minute too. Generally, acute pain's about 2 to 3 days max. If you're still having pain beyond that, then it may be time to follow up with the doctor who wrote prescription to make sure that we're not missing something, or now maybe we can move to something like ibuprofen, Tylenol, that's going to be a better option. And generally, anything beyond 5 days of use starts to increase the risk of an opioid use disorder. Interestingly enough, even any opioid exposure before the age of 18 increases the risk of an opioid use disorder in the future. So that's any. So if we can avoid any use by the time we're 18, life would be better and less of a problem. Side effects, most notorious is constipation. As if you're not feeling bad enough as it is, then you start feeling. Super Bowl ads this year, I think, were the first ones that had new medications that were supposed to counteract the side effect. So you take the opioids and then you take the drug to help counteract the constipation associated with the opioids. You can take with stool softeners or extra-soluble fiber. Personally, I like magnesium. One of the side effects of magnesium is loose stools. So you can actually use magnesium in the right dosages to help keep things moving. Can cause drowsiness. Never mix with other sedating medications such as muscle relaxers or benzodiazepine. This is the whole benzodiazepine and Valium is a whole nother monster that we're not really even looking at yet. But the combination of opioids and benzodiazepines is not a good one. Do not drive or operate heavy machinery. Most dangerous side effects: inadequate respiration, breathing. A lot of times when somebody passes from this, it's because they stopped breathing. Always secure safety meds in a safe if possible. If these are for your children, safe sounds a little bit, my kid's a good kid, he's not going to do anything, but it doesn't mean that other family members, especially young family members that may not be aware, may not have access to or may have access to these medications, and then based on body size, the dosages may be too high and not have a good outcome. So keep them secure in a safe if possible, and as I mentioned, dispose of any extra medications at the end. We don't hang them around for the next time, or I can't tell you how many times in practice I've had patients, oh, well, my neighbor gave me some Vicodin, or I've had some strange stories. I'm like, and these are usually should be dosed based on weight, and so if you've got your 350-pound neighbor that's giving the 75-pound child, it may not be a good fit. So When you're done with them, we need to make sure that we are disposing of them properly. There are drop-off sites. The police station, Chandler Police Station, has several of these. They're easy enough to find. There are federal and local take-back days where you can bring any medications you have and they will dispose of them properly. Do not flush these down the toilet. We have a huge issue with that. Even in Puget Sound in Washington, there was a recent survey. They looked at the salmon in there and they found that the salmon were loaded with antidepressants, I believe, in this study. And the closer they got to where the water dumped into Puget Sound, the higher the levels were. So we've done this for a long time, and we're now paying the consequences because they're showing up in the water stream. So make sure that these are disposed of properly.
And Walgreens also. Walgreens just started. They're the only pharmacy that you can take the medications back, but it doesn't make a difference what prescription medication is. All Walgreens will now.
Or where you got it from. That's always a good thing. Yeah. Yes.
Not all pharmacies will. Actually, Walgreens is the only one that will currently, because of their DEA regulations that they have at pharmacies, they won't take back any unused prescription medication. So just Walgreens.
Yes.
And then the drop box is at the police department.
So when we start getting into problems, be aware and get help if your child's asking for it, even when not in pain or after the condition's resolved, because then we start having potential problems for a substance use disorder. And catching these things earlier is always way better than later. So being aware of some of the patterns that may develop early on. Talk a little bit about some of the psychotrophic medications for depression, anxiety, any other psychiatric condition. Same thing, ask if they're needed in the first place. Any medication should be given, any psychotropic medication given for depression or anxiety should be accompanied by a recommendation for therapy, like period. I don't think to use these as their own tool is not the way they were ever designed to be used. And anybody with these type of diagnosis should be addressing it with a qualified therapist. I come from a family therapist anyway. My mom's been a master's level therapist for 30 years, so I've kind of grown up with that idea, that concept anyway. Still surprises me how many people are just given a prescription for Xanax or Valium or Prozac and not having any discussion about learning tools on how to manage these things in the long run. The meds can cause drowsiness, may need to take them at night. Other side effects may include dry mouth, stomach upset. Just like most medications, there's a long list. Schizophrenia or other disorders may involve, the medications for them may involve hallucinations or delusions, as well as the condition itself. Cause abnormal movements, spasms of the muscles. If you start having side effects from any of these medications and they're severe enough, then you need to make sure that you get back to the prescribing either primary care doctor or hopefully psychiatrist that's helping to manage the meds. Just like anything else, dangerous effects with meth if it's mixed with any other meds. If you're on any other medications and you're given a prescription for some psychotropic medication, make sure that you run it by both the doctor and your pharmacist to make sure that there's not any potential interactions that are going to be potentially fatal. A lot of medications cannot be stopped cold turkey. There are, getting off of some of the psychotropics, some of the SSRIs, it's a process. Going off them cold turkey, I usually describe, I've got a book on migraines and epilepsy, so I understand that aspect and a lot of anti-epileptic drugs. I always describe it like your foot's on the gas and the brake at the same time, and if all of a sudden you come off the brake, bad things can happen. So any type of psychotropic medication needs to be, especially in the longer you've been on it, the harder they can be to come off of them, and you need to come off of them with doctor's guidance. Understand as well that a lot of times these drugs take some time to really become effective. It's not like you're going to take it today and then tomorrow life's going to be good and you're going to look like the person in the commercials. It can take up to a month to notice an improvement, so give it a little bit of patience. That's a perfect time to start doing other things for your brain. whether it be exercise, finding a therapist in that time frame to help with the long-term management. Just like the opioids, never take more than prescribed. Potentially dangerous side effects on the heart or seizures with these type of medications, especially new onset. With SSRIs, a lot of new onset seizures is a potential side effect in the first 30 days. Always monitor and manage your kids' meds, especially with a history of suicidal thoughts or previous attempts. Sometimes that's not asked by the doctor who's writing the prescription. You need to make sure that you're proactive for your children, and make sure that the doctor who's writing it is aware of your child's history. Same thing, make sure that we're keeping them away from locked up in a safe or some other environment where other people, even if you have the perfect ideal child, we want to make sure that there's somebody else in the household doesn't have access to them. And we've already discussed as far as disposal. A quick primer on stimulants as well: Adderall, Concentra, Ritalin, or Concerta, Ritalin. These are drugs typically used to treat ADHD. They're relatively prevalent in the population. They're still stimulants. So we look at the amphetamine class and how much they may affect side effects. Again, seizures, even though there was just this week another article published in some of the epilepsy journals about the risk of seizures, and the idea was that these drugs, when taken not as prescribed or taken by somebody who they were not prescribed for, may increase the risk of seizures. However, when given prescribed, may actually lower the risk of seizures. So it kind of makes sense anyway. If they weren't prescribed for you, you should not be taking them, and there's a lot of other potential side effects associated with that. Aggressive behavior, problem sleeping. Long-term use can cause remodeling of the heart. Left ventricular hypertrophy, it starts to enlarge, and that's why you see in foreign, like cocaine users, heart failure is not an uncommon cause of death as a result of long-term use. Obviously, psychological dependence, and same thing is making sure that finding out if they're needed first, and make sure that we keep those stored in a safe place, and we make sure we get rid of them in a safe manner. Any questions about this? And if not, we'll kind of move on to natural approaches to pain management. No questions? Okay.